So good morning children. So let us continue with our topic. So we discussed in the previous session regarding health and disease and what are the factors that affect our health, and then what are the factors that cause disease. And then we also discussed that how diseases are identified. So how are they identified? By some signs or indications. And what do we call those signs and indications? We call them as symptoms. What are they called as? Symptoms. So what do symptoms indicate? Any kind of abnormality, any malfunctioning of the body part or of an individual. But then will symptom alone help us to identify a disease? No, because symptoms will be common for many of the diseases. So for example, if I take up fever, fever can be a symptom for typhoid, can be a symptom for malaria, can also be a symptom for tuberculosis, maybe even for normal cold, isn't it? So what happens? We cannot predict what disease we are suffering from. So we then go to doctor. So what doctor does, based on the symptoms, what all we tell to doctor, he will ask us to undergo some sort of tests. And why these tests are advised? In order to confirm what type of disease we are suffering from. So what a doctor is going to do, he is going to diagnose the disease. And how does he diagnose the disease? He is going to diagnose them by conducting certain tests. You all must be familiar with this. Okay, what sort of test? It can be blood test, it can be urine test, it can be sputum test. Okay, similarly you may also be advised to take up an x-ray. Okay, or we may also be asked to take up, like nowadays you must have heard about this, ECG or MRI. So these are some of the tests which the doctor advises us to take up. Why does he asks us to undertake these tests? In order to confirm whether the symptoms which are shown by a patient are of a particular disease or not. Okay children. So symptoms are the first indication of a disease, and the confirmation will be by what? By diagnosing, which is also not, we call this as what? Diagnosis. So which ultimately leads us to confirm that we are suffering from a particular kind of disease. So now let us see children, types of diseases. So we have learnt what are the causes and how do we identify a disease. Now let us see types of disease. Children, this part is not there in your chapter, but then this is the fundamental of your diseases. So just I'm discussing about the types of diseases. Now broadly, diseases can be categorized into two types. One, congenital, and the other is acquired, depending upon what? Upon the presence, in the sense when the disease has started or when it has begun. Is it congenital or is it acquired? Now what do you mean by congenital? Congenital means something by birth. So any disease which you have by birth. Now when I say by birth, it can be hereditary, that is running in the family, or due to some genetic disorder. And the examples we learnt in our previous session. So one example, and here of course I will mention here, like hemophilia or thalassemia. So these are examples of what? A congenital disease. Coming to acquired. Acquired means in the lifetime, which are acquired, or with the diseases which we get during our lifetime are called as acquired. Then the next question comes, how these diseases have been acquired? Is it because of person to person contact or due to some changes within our body? So based on that, there are two, which spread and which do not spread. So communicable and non-communicable. Okay, so coming to communicable disease. Communicable, as the name itself says, which spread. Okay, which are spread from one place to another or one person to another. Again, these communicable are further categorized into contagious, non-contagious. Contagious in the sense which are caused when a person comes in direct contact with the patient or with a deceased person, and these due to indirect contact. Fine. Now, what do you mean by direct contact? Maybe by touch, maybe by hug, maybe by kiss, or maybe by some sort of physical contact. Okay, now the recent our pandemic situation, okay, the disease which we are all, due to which we are all confined to our houses, the corona is also one good example of what? Our direct contact, because that's why we are always told to maintain a social distance. So not only this, even smallpox or chickenpox, when you suffer from chickenpox, you are confined to one bed or one room. Why? Because when we touch, we come in contact with these diseases. Okay. Coming to non-contagious, though they spread, but they are not due to coming in contact with a diseased person, but rather due to maybe consumption of wrong kind of food or contaminated food or water, or maybe by the utensils. So one good example here we can take up of is of or by vector, okay, which was spread even by water, vector. Fine. So malaria, dengue, okay, and typhoid are some examples of non-contagious diseases. Coming to non-communicable disease. Now these non-communicable diseases, we can again categorize them into 4 types. First one is deficiency. We are all familiar with this, isn't it? One good example we have is our scurvy, that is deficiency of nutrients. Then coming to the next one, degenerative. This is also called as organic. What is this degenerative? Due to some degenerations in the organs or the cells of our body. Okay, one good example for this can be our this one, damage to kidney or liver, or even Alzheimer's disease, wherein the person starts losing his memory and losing control over his body. So this is also called as organic. Then comes next is what? Allergic reactions. This we are all familiar. When some elements in the nature does not suit our body, we suffer from allergy. Maybe developing rashes, itching, swelling. All these are symptoms of what? Allergic reactions. Then the last one is cancer. This name also we are all familiar. So cancer also is due to some damage to our cells. Maybe due to some bacteria or virus. Maybe due to some harmful radiations or harmful chemicals. Okay children, so today we have discussed in brief regarding the types of diseases. Now in our topic we will be discussing about in detail regarding the communicable diseases. Now this is only our point of discussion. So regarding this we will be continuing our coming sessions. So please go through this, read the textbook thoroughly. Thank you. Have a good day.